Hello class, my name is Stephen Harrison and today I'll be talking about public health versus privacy rights, HIV testing, and AIDS intervention. This is presented by me, Stephen Harrison, and Monica Pearsall, uh, public policy and administration class. So the main issue we're going to be talking about today is what is more important when it comes to HIV testing. Is it more should be focused on patient privacy or public welfare? So some of the stakeholders, the first one being HIV and AIDS infected patients. HIV and AIDS infected patients would support patient privacy protected and prioritized over public welfare. These people deserve the same dignity and privacy as any other patient or person dealing with a disease or infection. The second stakeholder would be mothers of newborns. Mothers of newborns would support patient privacy being prioritized over public welfare. While many mothers may elect not to have their newborn screened for HIV, others may fear possible consequences of receiving a positive result. Okay. So the third stakeholder would be Jean Petitstient, uh, not a common spelling last name. Uh, so Jean would support patient rights over public rights. Uh, he understood what HIV positive patients may go through and how they may fear consequences of knowing a positive result. Okay, so the fourth one would be Dr. Nora Smith. Dr. Smith would support patient privacy over public welfare because of laws that say informed consent before testing can be performed. These This includes patients such as newborns and their mothers, uh, uh, consisting to newborns being tested for HIV. Dr. Smith believed people had the right to be protected both from the spread of HIV and from illegal invasion of the patient's privacy rights. Those would be rights such as HIPAA. Okay, additional stakeholders would be Salvador Gambarella. He believes that if you can tell somebody about you being infected before you have sexual intercourse with the individual, that you should be released from wrongdoing. So he in particular was prosecuted because he said that, well, he had sexual intercourse with an individual and he said that he consented. He advised the female before doing so that, he was HIV positive. And the woman stated that no, he did not. He did not say that he was HIV positive at all. So in court, it ended up that he was lying, and they believed that she was telling the truth, so he was prosecuted. Another stakeholder would be state laws of disclosure of infection, which would fall under the same area that Salvador was. Made it a law to include up to 10 years prison time if you give someone the disease without disclosing it beforehand. An additional stakeholder would be Dr. James Trussell. Uh, Dr. Trussell uh, like focused more on making it to public aware of the severity of the disease and how effective the tests are for detecting it. The last stakeholder would be Alan Brandon of the National Academy Study Group. He supports keeping the information private due to individuals that suffer from the disease currently. Uh, he made a good point saying that they're being isolated if it were to be like publicly released about their disease, and that they would face severe social inequality. Uh, even though it's HIV, it's contracted through sex, but it's like any other disease. I mean, that's against violations. But so so our recommendation, Monica and I, would be we would recommend HIV screening to be left to the individual, and results of such tests should be kept 100% confidential and only be done with consent. Every patient should retain the right to testing, treatment, and complete confidentiality. Public welfare is protected through education and being tested when consent is given. So we came up to that idea, so we would currently, be the same as what it is now. We came up to that because, it's against violations against HIPAA, and you shouldn't release somebody's confidential information. That's like releasing somebody's financial information, somebody's personal information. It falls into the same basket. You are not supposed to release information that you are not granted access to even obtain outside of being there a medical professional. Okay, so public health versus privacy rights, HIV testing, and age intervention. These are some of the questions that Monica and I both asked both of our professional professional videos that we did. The first question was, what is more important, patient privacy or public welfare, and to what extent would that mean? The response we got from that is, overall, is patient privacy over public welfare is number one. The public needs to know of HIV cases without names of the patients infected or tested. So basically, they need to be aware of the potential risk and also what they can do to negate HIV, what practices that are set forth, the various practices that are today, practicing safe sex and knowing what the disease entails. The second question we asked is, where do you stand on mandating HIV screening of newborns? So they both said no. They both said that only babies of HIV or AIDS positive mothers should be screened. Newborns are subjected to many routine blood and other screenings, and unless the mother is positive, there is no reason to even administer the test. Going back, Dr. James Trustwell, he made a big point about unnecessary spending of HIV test kits, and if the mother is not HIV positive, that it shouldn't even be a mandate that the newborn would be tested of it. Okay, the next question we have is what do you recommend to help control the spread of HIV among people infected or at the risk? And as a generalized response, they both said, public education, supplies for testing being made available to clients that serve communities of people at higher risk, and free free contraceptives to protect against the spread of HIV should be available through funds allocated for protection. Now that can be done through funds health departments and nonprofit organizations receive for prevention. So when I talked to my professional, RN Indira, she said that there are currently services available, such as you can go down to the health department or you can go to Planned Parenthood and they will provide you with condoms if you want a germicide or pesticide. It's kind of like a specimen that kills the cells and whatnot, spermicide. And there's various different things that you can use to practice safe sex, and being knowledgeable about it, she said, is the number one thing. Okay, so the next question is, should there be mandatory HIV screening for anyone wanting to get married? So they said no, no matter what sexual orientation, race, or community, government should not have involvement in their health related matters involving HIV screening. So both of them generally said that, hey, like the government shouldn't be involved too much in your personal business that should be, to your own beliefs and who you want to be with and whatnot. But on the other hand, in the book refers to that HIV is more contracted through homosexual activity. So, and when when that first came about, when HIV first came about, that was the biggest thing. Doctors actually thought that the disease itself was only contracted uh, by homosexuals, more so homosexual males, because that's where all the cases was coming from. We found out down the road that that is not the case, but that now there's resources. Like I said, there's condoms. There's actually medication that you can take if you are HIV positive or AIDS positive that you will go undetectable if you take your medications appropriately and you stay with your doctor. Your blood will have such low level of HIV that it can't even be contracted from a non-HIV person. So there's definitely things that you can do, and pretty much that's how it is. The next question that we had is, do you think the government should allocate funds for free HIV testing and treatment for anyone in the United States? The response we got is no, insurance should cover it, given patients pay for insurance. HIV positive patients without insurance should be able to easily apply for free screenings and treatment through an affordable insurance plan and nonprofit agency that can help them get the help that they deserve and need. So back in time in the 80s, AIDS was a big epidemic, and there wasn't resources that there is now, and even if there were, it was so costly. But that's not the case today. Now things are a lot cheaper. They're easier made. They're massively made, and healthcare healthcare should include for these benefits. Theoretically, somebody that has HIV that turns into AIDS, they can die. They can get very sick, get very slender, lose an appetite, and I mean worse if it goes untreated. I mean they can die. So it's very important that you focus on that, and that the government can allocate funds to help combat this issue. Now, this issue is nowhere near as bad as it was back then, but it's still a very big issue among homosexual individuals and among heterosexual individuals. It doesn't matter your sexual orientation. Um, you you can get it anyways, but it should be protected. It should be something included by the government so future outbreaks doesn't happen. Okay, and lastly, these are the two individuals that we interviewed. Monica interviewed Monica Hines. She's an RN. She has her master's degree. She has a master's in science nursing. She works for Baycare as a registered nurse in one of their units. So she has 20 years of experience in nursing. She did a very great job. She provided very useful information. She has tons of experience. So before, when she was on the job, years ago, AIDS and HIV was a very much broader thing, because it was less researched, less developed. But now that it's a very common thing, she was able to provide us both feedback of from a long time ago and feedback from still today that was both very usable to help kind of help us with the history of the HIV and the developmental process of HIV, and what certain practices and policies they use within the hospital. Okay, so the second individual, the lady that I interviewed, her name is Indira Caridad Villarreal. She is an RN. She's got her bachelor's degree in nursing. She's only been with her nursing program for 3 years. She works for Sarasota Memorial Hospital. She didn't have too much information due to her not having, just simply not being on the job enough, but she just came in contact with a couple individuals, and just like Monica, she also agreed, like, hey, this is HIPAA, that it should be kept between the patient and the nurse practitioner or doctor within that moment. That it shouldn't be something that was disclosed, but he was still able to provide very useful information, uh, and had a lot of data on the topic. Thank you for watching my presentation, and I hope that you have a good night. God bless.